Good afternoon, everybody. It's Wednesday, the 26th of April. We are so sorry we had technical difficulties with GoToMeeting. It's been happening to Richard and me this morning, but we're here. You've read a little bit about James, and let him do his own self-introduction to get started with this webinar so we can get going. James, thanks for being here. We know you're a busy guy,
Hey,
so it's all yours.
okay, all right. I practice with my wife, Veronica. Just a little introduction in Wichita, Kansas. I'm a PhD biochemist and molecular biologist. I did that degree first, and then in my early 30s, I went to medical school and MD, obtained that, and then went into family medicine, probably because it was broad and general and interesting, and I like the diversity of it. I've been a doctor now for 20 years. Um, and I've spent a little bit of time in the functional medicine world, but I've spent then some time in the environmental medicine world, and then I spent some time in the cognitive medicine or neurofeedback world. I work in the office about 2.5 days a week. My wife is here full time. I medicine wise, I do general medicine and then what I call cognitive medicine here in the office. And then I'm really kind of a full time bread and butter heavy lifter in the emergency room. So I practice a whole gamut, which is very fulfilling and interesting to me. I don't know if it is on.
No, you're still there.
All right.
Yes, you're here.
All right.
We hear you. You're good.
Okay.
I'm
So,
unmuting people too.
okay. All right. I wondered if I was just off in space
Well,
talking to
it,
myself.
good.
so, so I, so
It
this is
happens.
a new thing, and I just want to make sure. But what I think as it relates, in our office, my wife does neurofeedback, and I'm familiar with the technology and how it works and the different results of the data. But I sort of work on the pre-neurofeedback level because I think that there are impediments that we see that impact the result of neurofeedback. And so I many times share patients with my wife, or I have patients that I see that I sort of prepare to do neurofeedback. Um, uh, and so there are impediments. Uh, One of the ones, and my wife's holding up a piece of paper for me to just talk about, is mold. And so I'm happy to talk about that. But I wanted to ask you, does anybody have any specific questions about mold?
Yeah, James, I'll start with a couple of questions. It's Rob.
Sure. Uh-huh.
I actually had to go deal with a family member who has since passed, but she
Uh-huh.
started having memory deficits and was probably
Uh-huh.
dementia. So we took her
Uh-huh.
to someone who was practicing that Brizendine method.
Uh-huh.
And one of the tests they did was mold. And she
Okay.
went nasal swab of hers.
Uh-huh.
She came up
Hmm.
positive.
Okay.
Now, there's different types of mold. I don't even know what kind of mold I was testing for that,
Uh-huh.
but I've spent time in her home
Uh-huh.
now because my wife's father also passed away. So their house, which they're getting ready to put in the market, when we
Uh-huh.
were there, they came to do an inspection, and there was fungus
Uh-huh.
and mold underneath. They had a crawl space, so we had all that for
Uh-huh.
$40,000 corrected. They had to take and
Whoa.
remove
Uh-huh.
joists and fungus and mold and replace wood and redo the
Uh-huh.
whole capsulize that area. So that mold, of course, being underneath the house, is going somewhat into your air duct system, and
Yep.
that duct system is there now for probably 60 years, never been cleaned, plus all the moisture and everything else. That I'm throwing you that question because that's a way of getting
Uh-huh.
mold, and maybe it would expand on ways
Yep.
people can contract mold and things to look for in their own home environment.
Yep. So about 25% of the population has a real sort of disadvantage uh, uh, immunologically to mold, and they're going to be very reactive to it. And there's several things, several ways that we encounter mold, and there's different tests that tell you different things about it. So the first is exposure, right? So people have exposures to mold, and actually they can be really tremendous and very profound. So I had a patient a couple of years ago that went from one office to another, and in that office he started getting sick. He's a man in his 30s. I thought it was anxiety. Did a QEG. He was like, it wasn't anxiety. There's a huge amount of delta present, and I wondered if there was anything new. He told me about mold, and he got a mold filter. American Environmental is a company. I think it's national, and you can investigate it. They brought in a trap, which had a filter in it, and they were able to, based upon the rate of filtration and then spores in the trap, be able to calculate the amount of spores per cubic centimeter per milliliter volume of air. And I was stunned. It was like 10 to the 8th. I was like, and then I calculated how much you filter in your lungs. You filter about 8,000 liters a day when you breathe. We are sort of filter feeders for oxygen, and in a regular period, he was filtering at 1 times 10 to the 8th milliliters in an 8-hour day, 3,400 liters. And I was like, this must look like the zombie apocalypse in the lungs. I was a little aghast when I did the calculations, and I was like, how could you even see in that room? But these spores are very microscopic. They're invisible. You can have a huge load and a huge exposure that you really aren't aware of. And what happens is we breathe it in, and then we filter it in our lungs. Most particles of that size don't make it to the periphery of the lung. They get caught up and they settle out on the bronchioles and the bronchial tubes, and the mucociliary ladder, this mucus that we cough up, we produce about a liter a day. We swallow it. So we swallow our exposures from our lung. We don't breathe it out. We swallow them. So one of the tests to look at exposure that we have is we do a urine mold test. It's about $400, but it's a good exposure test. It looks at about 30 different molds, and it shows what we're exposed to. So when you do an air filtration trap in an office, and then you do a urine mold test, and you see that increased exposure, it's huge. Okay. So that's the first thing. And where you're able to bind that, actually, there's 2 binders. Medicinally, we can use an FDA-approved medicine called uh, uh, cholestyramine, and I use a lot of that in my practice. And we clearly see improvement in cognitive function with that. And then you can also use bentonite clay, works real well. But if I'm a little worried that people will say, well, I went to this doctor and he told me to eat dirt. So, but it works great as a binder. I just tell you that. And they've actually put clays as binders in feedstocks, because about 25% of grains in the world are contaminated with mold. And so they put these binders in the feedstocks to bind the toxin and not have the mold effect on the poultry and the swine and the other farm animals that we grow. And actually there's books, veterinary books that describe the effects of these molds on grains and animals. So we clearly have an effect, and it clearly has an effect when we have the toxin in us. But the other real component is we then react to it. And then to see the degree that we react to it, we do an antibody test, an IgG antibody test, and we see if there's been some reactivity to it. So it's not just exposure. And people in the mold world are like, look, you need to know that you're exposed and remove yourself from exposure. but you need to also see what the body does to it. So you might have a little exposure, for example, but your body says, hey, I don't care that it's a little exposure. I'm very reactive to it, and it makes an immune response to it. So we do both tests. What I would tell you is I've had 4 frontal temporal lobe dementia patients, and they should die within about 6 months. And they've all had high mold exposure levels. And when I treated them with cholestyramine and they remediated their environment, they actually did not die in 6 months. They actually continued to live year over year, and they went down. And I send the note to the neurologist, and I said, I think this is an issue, and I get no reply, just zero response. So the medical world doesn't know what to do with mold. I think some of it has to do with the cost, legal implications of it. I, so that's a general overview of what of mold. It's clearly doing 2 things. I think it's contributing. Many of them mitochondria. Many of the mold toxins are mitochondrial toxins, and they lead to mitochondria dysfunction. And in Kansas City, there's a ENT. No, he's an infectious disease doc, and his name's Joseph Brewer. And at the Lyme conference, I think maybe 8 or 9 years ago, he gave data on mold exposures in his chronic fatigue patients, and like 95% of people had high mold levels. And he also used cholestyramine at that time to remove them and lower them, and he clearly got improvement on fatigue. So you see that it's clearly contributing to brain dysfunction and poor mitochondria function.
So sleep would be a symptom, someone who's not sleeping well. What other symptoms might they notice with mold exposure like that?
Mostly they have fatigue. And
Fatigue.
in general, and I think what happens on the Q is you see just a higher fraction of delta compared to the other fractions, and it's global. So it's something that I look at when I see a Q and I see all this high delta. I'm looking for causes. Dementia is 95% environmental, right? So, and anybody with frontal temporal lobe dementia, I clearly do a mold test, right? Do a mold test. And when people are going along in life and something happens, like, hey, I was just going along, and then boom, something happened. That's usually an exposure history, right? They've usually caught something or they've been exposed to something, and you should try and figure it out. The medical world does not know how to deal with that very well. The general medical world. Any
Well,
other?
Is there something specific? This is Nathan from Oregon. I'm wondering if there's something about the neurophysiology of mold exposure that leads to the frontotemporal dementia. Will we see that also in the frontal and temporal lobes, or those show up in CNS vital signs as early signs?
They could be. Alzheimer's dementia and CNS vital sign clearly has attention, executive function, and memory components, right? And that's the same as frontal temporal lobe dementia. So it's hard to tease apart in a CNS vital sign. What happens also with frontal temporal lobe dementia is that it many times it can be associated with Lewy body and hallucinations. Very different pathology than sort of loss of cognitive function. But I think my personal opinion is some people have long-term exposure, they're sort of dealing with it, and they have these deficits. And I think that people, when they have these deficits, you ought to screen for mold. I absolutely believe that.
Now, when you were talking about the map, this is Rob again.
Uh-huh.
Was it globally high delta, you said, or frontal elevations in delta?
Yes and yes.
Yes
Yeah.
and
So
yes. And
yes,
eyes closed, eyes open, or either or both.
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 Right. So
Okay.
both are that. This is, my dream of dreams. A billionaire comes in and says, here's $100 million. Let's sort this all out. Because my belief is that that there's lack of energy has multiple causes, and then we need to sort out which one is the predominant and knock it down. And then the next most common, toxins and antibodies. And I tell people this a lot. Antibody. This is work from Schatz, and I've said it before, but I find it very fascinating. But antibodies, when they bind to a neuron, change frequency. They change frequency. And there was a presentation we did about 5 years ago in which we showed, actually it was 2 hertz. We just 2 hertz section of the brain, 5 minutes after eating in a celiac patient, that is a man that had 7 antibodies to gluten. He ate 5 cookies and his brain remarkably slowed down, and so, and it really hit the anterior and posterior cingulate gyruses. It really did that. And then when we did the 3D reconstruction, it's just like the whole, just as if you were to make a 1 centimeter cap over the brain, that was all slow. Because when this is something we don't realize about the brain anatomically, and we didn't know this for a long time. The whole venous sinus in the center part of the brain we imagined was sort of this pool of venous blood, kind of like a lazy river, that just sort of cushioned the blood, and uh, you're like, okay, and then it drains. But some work at Duke about 7 or 8 years ago, they sectioned this, and what they found is it's a very, very fine retinaculum, a meshwork of fiber on which white blood cells sort of hung out. And so this venous sinus is really a immune organ, and it rains down onto the brain cytokines once they're activated. Uh, so there's clearly you have to couple immunologic reactions to behavior, and that's what we see. So it's not, the behavior is not a cognitive, thoughtful process like, oh, there's smoke in this room, or oh, let's leave that room, or oh, I think there's black mold in this bathroom, let's not come in here. And oh, what happens is, in those cases, you have physiologic responses and you feel sick, and it affects movement. And the movement side, in my opinion, is clearly activated in order to not spend time thinking about the issue. Like, get out of this room, right? Get away from the smoke. So I think this phenomena is very ingrained into our anatomy and our neurophysiology. Any questions? Any thoughts?
Yes. Remedies.
Is this Nathan still?
Scary.
Okay.
Remedies. What do you do if you got it?
That's a great question. So the first thing is, to identify there's a problem, and then you have to remove yourself from the exposure, and that's difficult, and it can be expensive. I've had a couple of people come with really hardcore mold tests, and one of my patients that I saw already this year, her employer did not believe that mold was causing these effects, and she was sky high. She was having horrible gum disease as a result, and some actually sarcoidosis-like effects. So she needed to get out of that, and then I think she may have infection. So I treated her. There's different antifungals that you can treat. There's nystatin, of course, and there's diflucan, and you can use those. You can use those as you need. So, and then you can use the binders. The people have different opinions about binders. When I put people on a binder, like cholestyramine, I clearly see improvement on CNS vital signs. So sort of like, maybe you had low average in those frontal lobe domains. We see them come back to midline in those domains after cholestyramine. So it's like, what? Really? So yeah, there's things to be done, and they should be done. I'm a little aghast that the world hasn't caught on so much. That's my opinion.
My name's Andrea Powell.
Uh-huh.
I would say that why I haven't caught on is because I didn't know some of these critical details that you were describing. My anatomy is too old. Well, I don't know which, I don't read enough. I'm not sure. I didn't know about the sinuses. I know about the usual sinuses, but not the brain sinuses. And several of the details that you have mentioned today. So I'm extremely grateful for this.
Oh, okay, good. Part of my plan ultimately, if I could dig myself out of all the patient work, is to really put together maybe 20 YouTube presentations. I would admit that this is esoteric knowledge, and just you'd kind of have to bump into it and then go, oh, wow, that's really important, and I would say too, there's not very many offices that have this equipment and then can do the testing, the functional medicine side of testing or medical side of testing. I think we're very fortunate that this office can do that.
Hi.
Yes, I had no idea. When you say mold testing, I'm thinking of the mold testing from, I don't know, 10 years ago, which had one of the issues might have been that it couldn't have been explained to me at that time. So thank you.
Well, and I think that's a very good point. 10 years ago, the mold testing was Real Time was the company. They charged like $800 or $900, and they tested for 3 molds. And then came Great Plains Labs, and they did mold testing on like 16 different mold toxins. And then in the last 5 years, Vibrant Wellness has really gone into the functional world. They are probably like the real life Theranos, if you've heard of that story. And they are able to do really an amazing amount of work with their equipment. And they have IgG mold testing for several $100s, and they have urine mold testing that measures 30 different molds for about $400. So we went from 3 molds and $900 to 30 molds and $400. That's like $15 per urine mold test. So from 300 per urine mold per species, 300 to 15. So there's been a dramatic improvement in technology. And I admittedly go, the American Academy of Environmental Medicine is maybe 200 members, maybe 100 members at a conference. Very interesting information, but you know, 100-member conference is not huge when you think about 400,000 physicians. The reason I got into environmental medicine is for the simple fact that when you want to find the root cause of disease, it's environmental about 70% of the time. In terms of neurodegenerative illness, it's probably 90 to 95%. So if you're going to make the brain better and understand some illnesses, you have to look at the environment. And that's admittedly environments that's like sports or neurofeedback or psychology. That's really a big catch-all word, but you have to start there and then break it down into meaningful components. And mold's one of those.
What was the name of that company again that did the 40 different mold tests?
Vibrant Wellness.
Vibrant Wellness.
Wellness. And, you know, there's another really important component of mold detoxification. And this is a fascinating component, and that is sweating. And so, and this has some really fascinating components too of little known physiology. So the skin, where the mold is and toxicities are, the skin can be really affected. And the skin, and this is little known, produces about half of our testosterone and half of our progesterone. Like, what? So the skin is an endocrine organ, and I've seen a couple of things out there where people are actually remarking on that component. And so when you have mold on your skin or in the exposure world, you really have components affecting hormone production. And at AAPB in Chicago in 2018, there was a very fascinating keynote speaker named Charles Raison, and he is a psychiatrist at Madison. And he had found with his clinically depressed patients that hadn't responded to medicines, and these were people that were hospitalized for depression. He had found that he could heat them up in a device that Baum, who is from Germany and who are sort of sweating aficionados and enthusiasts, they paid for this machine. And he described in this conference, you know, what happened when he put people in this machine and got them up to about, you know, for 30 minutes to 102 degrees, and he was getting them to sweat. And he said depressed people don't sweat. And he got them, I think, 1 or 2 treatments of sweating. He got clinically durable improvement in their depression at 30 days of like 50%, or 2 months, 50%. It was astounding. It was just astounding. And he said, interestingly, he said, depressed people don't sweat. So I went to him and I was like, you know, did you know all this stuff about hormones and mold and detoxification? He didn't. And he got busy doing some other work. We lost contact. But sweating is really, you know, in mold treatment, you ask what else can be done. Sweating is really critical for that. It is a detoxifier, and there's clear implications on hormone production that will result in cognitive improvement. Fascinating, just like crazily fascinating.
Well, a sauna would be a good idea.
Yeah, yes. Yeah, an infrared sauna, you know, medically used correctly. Yeah, it's a good idea. And you know, I'm sort of a fan of, hey, whatever you do functionally, why don't you just, you know, get a map on it and do cognitive testing before and after. Those are just super, it's just super fascinating, just super fascinating.
There was also some research about plunging into ice water being effective for depression treatment. So that whole ritual, the ritual of the sauna into the cold lake gets bold.
Yeah, I listened to this podcast on the Huberman Lab, who's a PhD neuroscientist. It doesn't sound like he does clinical stuff, but he was at Stanford, and he was talking about durable dopamine increases with cold exposure. And I thought that was, okay. I don't know why that would be, but he was talking about them. So, and I recommend listening to his lectures on dopamine and motivation. It's super fascinating.
Hey, this is Connie Sturzer. I was wondering if you would be able to describe how mold impacts memory.
Okay. The question is generally that it affects mitochondria function. So the mold toxins target mitochondria, and they can target it secondarily as inflammatory molecules. So you have something that causes an inflammatory response. And so in general, just imagine mitochondria, and then you go down to the mitochondrial membrane, and you've got essentially 3 proteins, complex 1, 3, and 4, that are passing protons from the inside to the outside of this membrane. And then you have cytochrome C, which is complex 4. And this is complex 4 and cytochrome C are really amazing proteins. Because mitochondria are mediating a lot of physiology. So one of the things that can happen is you have inflammation, and then you raise tumor necrosis factor alpha, and it goes into the cell, and just like its name says, it causes necrosis. So how does it do that? It goes to the cytochrome C, it binds to it, and it causes cytochrome C to, instead of binding hydrogen and oxygen and making water normally, it makes nitric compounds and peroxide compounds. So it actually changes the substrate and the reactivity of this complex and makes it essentially blow up the mitochondria. And then cytochrome C is free floating, and then by itself, free floating acts as a apoptotic or cell death signal in the cell. So when you have inflammation, or when you target mitochondria specifically, which happens, you wind up with loss of power. Clinically, what we see in a sick person is weakness, like that, right? Weakness. And so what we see on a more subtle note is decreased power, And memory, and the way I think about it, and my hypothesis about what memory is memory is, when we see it neurophysiologically, that's the result of alpha and theta binding to gamma, coordinated by the hippocampus. So you get a higher energy power that's creating the attention and limbic system waves from alpha and theta in the frontal and limbic system. That's why we remember. So I remember clinically. It's something our attention focuses on, and it's something that's important. So it affects memory. So
wait, can you just say that last bit one more time? It's the first time I've ever heard that.
It's my hypothesis. So I'll back up and be a little clearer on that, and then I'll tell you some other interesting things about memory that I hypothesize. Memory is the result of 2 things. You attend to it and you see it, and then it has to have, so that's our frontal lobe, and then right behind that's our limbic lobe, and we attend to things, and then we remember them because they have emotional significance to them, to us. We remember our wedding day, we remember our anniversary, we remember 9/11, remember different, remember what caused our children to cry, because they have emotional significance to them. And so I generally think of frontal lobe as alpha generation, and I think of the limbic system as theta, and alpha and theta bind in a binding rhythm to make gamma. And my belief is the hippocampus coordinates that binding rhythm. It coordinates that binding rhythm. That's how I think of memory, clinically and neurophysiologically. And then when I test, when I test patients, when I see a bunch of delta, and then I lower that delta, and I get more alpha and theta, I get more of that power generation, they test better on their memory and attention and executive function. They really do. So I'm like, okay, I think it's how it works. I don't know. But I could hypothesize that if anybody's interested.
Dr. Seberger, Nathan again from Oregon. Based on that mitochondrial pathophysiology, do you see low power maps and suspect mold as well?
Yes, I do. So I do. Whenever I see low power, I'm always suspicious of that, and I think that's the value really of the map, and there's I was like, it's all power, and the reason that is because I had a very demented lady come to me. She was stage 3. She wasn't speaking. She wasn't walking. She wasn't feeding. Her husband was devoted to her, and said like, I want to be, let's keep things real. All right, just help her as best you can. But he came from a scientific background, and he let me do some measurements. And when we mapped her, there was nothing. There was just slowness, and there was no alpha theta, just nothing. And I was like, oh yeah, and that's in the books too. I'm like, oh, we go from something to nothing. Is how I looked at dementia as it went through its stages. So I'm like, we've got to, what's causing all this loss of power? And we know that the neurons go away. We know the brain gets thinner and loses density. So it makes sense, and that's how I've modeled my thinking about dementia, is just going to know less and less, and then finally know power. Now, Richard, I talked with him about this a couple years ago at a conference. I'm like, well, I got all these smart people, and I look around, and they all have low power, so my theory has to go out the window. And he's like, look, there's something about, and this is true, it's efficiency, right? So the brain is efficient, and it really correlates with education, right? So my patients with graduate degrees and undergraduate degrees and on up, they all have efficient brains, and we don't know, and I don't know if you can, if you have an efficient brain, guess what? You can go to college, or you go to college and you develop an efficient brain. I don't know which of those two it is. I suspect people have brain efficiency, they do better, and they get into college, and so we're just selecting for brain efficiency. What Robert Thatcher talked about several years ago. He was talking, in his studies, he was looking at timing and timing mechanisms really as being what correlates with sort of great function. So the great functioning, the top fourth at West Point, when he measured them, they were really the neurons were really very accurately timing and getting the information in correct phase. So it's fascinating. But to go back to your question, when I see a lot of delta from my original observations, I'm suspicious something's present. So. Any other questions? I kind of did a departure on that. One question my wife has is, do pharmaceutical medicines work? And I think the answer is yes. I do. I think the answer is yes. Do I think they're the answer? The answer is no. I think they're helpful, but the lack of the medicine is not the root of the disease, right? But they can improve things.
This is Judy Pritchison, and
Yeah,
I'm thinking about the pervasiveness of mold in some people's homes and in their environment. So now we get them to measure that they have mold, but then we present them with this terrible dilemma.
Yes.
So where do you put your resources?
Yeah.
On one hand, you can take something to bind it or treat it, but you're not preventing it from reoccurring unless you do a huge makeover.
Correct. Yeah, this is actually a fundamental issue in environmental medicine. I kind of call it like, oh, the consequences of this answer are so great, let's not get to the answer, and we're not so acutely sick, right? If we were vomiting our guts out or having 10 out of 10 pain in our knees or our eyeballs, we would get to the answer. We would spend the money. But it's just such a subtle little loss. We don't sense it very much. And it costs a fortune, like, really? So, I hear you, Judy.
I know people who feel poorly because of mold and other environmental toxins, but the cost of remedying it, the cost of moving, the cost of then where do you move to without toxins? And I remember years ago listening to a lecture by somebody who said he built himself a concrete house. And but that's so unreasonable for most of my patients.
I know.
People that we see.
I mean, I have a friend of mine who's a builder, right? He makes developments and builds and stuff. And I'm like, hey, another separate issue is like the CDC is like these PFAS chemicals, right? It's like we can't have them, and they're just in all our building materials. Another toxin. It's really affecting energy production in mitochondria in the body, and I'm like, I think the answer is actually concrete houses, or they've made these giant sort of inkjet-like machines that can literally spit out a house in 3 days. I'm like, what? So I think it's doable.
And then there was a recent piece, James, in the Health Science News about that. Everybody loves that new car smell and what those toxins are doing to us in that new car.
They've actually done studies, and that's called off-gassing, and it's one of the reasons my wife doesn't like this. She's saying, I want a new car. I'm like, no. 2 years is what it takes to off-gas a
Oh
car.
my gosh.
It takes 7 years to off-gas a house.
Wow.
So I just, that's just in general.
Got to make our choices.
Yeah, it's this fascinating thing is maybe the brain is I'm generalizing a lot. I admit that, and I'd be wrong, but the brain's an inhibitory organ. Generally, it's an inhibitory organ. The body's just ready to move and do stuff, and the brain is sort of I'll pull the pin so you can be the jack in the box. That's why we get fast movement, fast thought. But it's primarily inhibitory, and these things are really inhibiting the inhibitor, and that propels us into action and motion and behavior, which then can continue. So that, new car smell, you could go, maybe that's how it's working, right? You, instead of going, oh, it costs this much, or I shouldn't have this car. I just, I'm like, really? All measurable, frankly, but maybe conceivably that's what's happening. That kind of what happens, mold is an example because this is an environmental thing that's affecting the brain, and maybe we have this noxious substance that changes our behavior, or maybe it's like the X-Files that's lulling us to sleep to keep doing the things that compels us to make the environment better for mold. That's creepy, but maybe that's what's happening, right?
All the flooding and everything going on, the environment is
Yeah.
much more conducive in so many areas for mold.
Correct. Yeah. And we'll have more outbreaks and more disease. And, really we should be treating it. We should be identifying it and treating it. Vibrant Wellness has a single owner, proprietor. I mean, he made the company, and he's clearly trying to identify the causes of disease and provide low-cost testing. And his testing is reduced by half, at least, compared to the other testing facilities out there. That's why I mention it. And give a shout out to him. He invests in the technology. The technology is fabulous, and the cost of the tests are less. So it's worth
That's a
it.
good note for us to wind up on, because I know we're at the top of the hour and folks will be leaving to go back to patients. James, thank you so much. We really appreciate your time. Anytime you want to come back and talk about mold or something different, I know you're bored to tears at times in your life and you just need something to do. So when you get to that point, you let us know. We'll have you back anytime.
Very good. Thank you. Thank you. Thank you.
Right.
Thank you so much for today.
Yes, thank you.
Thank you. Thank you. Hope it helps.
Thanks. Bye-bye.